and welcome to the Council for Drug-Free Youth Listening Post. I'm Joy Sweeney with the Council for Drug-Free Youth, and today our guest is Natalie Newville with the ACT Missouri of... Welcome, Natalie. Thanks so much for being here.
Thanks for having me.
And she's our Public Information Officer with ACT Missouri, is that correct?
That is.
Okay. Well, I'd love it if you could tell us a little bit about ACT Missouri, who they are and what they do.
Okay, well, we are the statewide training and resource center for drug and alcohol prevention. So our focus is mostly on youth, and we are at the state level. So we have 10 regional support centers across Missouri, and then about 165 community coalitions. So our job is to take all the latest and greatest research, trainings, webinars, that kind of stuff, and then we push it down to the regional support centers, who then push it down to the coalitions. So we try to provide anything that's cutting edge, science-based, that kind of stuff, so that communities can really work on prevention in their areas.
So best practices from the state level, spreading it out to all of the coalitions like Council for Drug-Free Youth, right?
Yes, most definitely. We have a website where we have different webinars and things like that that we archive and provide for free. So anything like that where we can help the communities really work on prevention.
Okay, so you are the information officer for ACT Missouri. So what specifically is your role as in that position?
Well, my role is this, getting out in the communities and telling people what we do and what resources we offer, because we want everyone to have access to that kind of stuff. I also handle our marketing with like our website, social media accounts, that kind of stuff. And then I also do our legislative stuff. So I try to keep everybody informed of what's going on at the Capitol, especially when it comes to prevention topics, so that they're well aware of what's going on over there.
And so that as an individual coalition such as Council, I mean, we're right here in the Capitol, but there's representatives from all over the state.
Right.
So if something's going on with a representative from St. Joe, the coalitions in St. Joseph, Missouri would know what's going on, and they could reach out to their local representative there.
Right.
Is that okay?
Yeah.
And why ACT Missouri? Why do you do what you do?
Missouri is unique in that we all share information so well. So it's nice that the way that we work is we get information from national resources and national partners, and we're all able to talk to each other and communicate what's going on. You know, when there's different topics such as underage drinking or prescription drug abuse, those are things that we can all work together. It's not just one agency in one area that's going to be able to work on those problems across the state. So we try to bring everyone together to work on that stuff. Okay,
and so do they all have to come here, or do you go to them?
It's both. We have a statewide prevention conference in November, usually it's in the fall sometime, and that's a great opportunity for all the different communities to come together and learn from everybody across the state and everyone around. So that's one example where people come to us. We also go out and do different trainings across the state. In the fall, our Maya project director and myself went out and did different youth trainings and social media trainings, so we went to them. So it just kind of depends. We do a lot of stuff online as well, so webinars and things like that where people can just come online and then nobody has to travel.
Right, okay, so it saves a little bit of money, especially with the small, knowing that like Council for Drug-Free Youth is a relatively small coalition.
Right.
We don't have the resources to spend a myriad of money.
We're all nonprofits, so we try to remember that.
Right, and spend the money judiciously, right?
Definitely.
Well, Council for Drug-Free Youth is very concerned, and one of our focus substances this year is underage drinking. What can you tell us about underage drinking in Missouri, and specifically in Jefferson City or in our community here?
Well, I think that one of the most shocking statistics to me is that the average age of first use is 13, both in Cole County and Missouri. So most kids, if they start drinking, are going to start when they're 13 years old. So I think that shows us that prevention needs to happen early. Kids need to feel like they can talk to their parents. They need to feel like they have someone to go talk about those issues with them. So, you know, as far as Cole County, Almost 41% of students reported that they've used alcohol before. So that, I think, is shocking in Cole County.
Of all ages or just a specific age?
It's with the Missouri Student Survey data. So I think that they do 6th grade through 12th grade.
That's what that's done.
Yeah. So, and that's whenever ACT Missouri puts out statistics or uses things on our fact sheets, that's a lot of the data that we get when it's Missouri specific. And so that's great that people can go to that and see what I think sometimes a lot of communities they want to believe that the problem isn't there. But we all know, especially those that work in prevention and recovery and treatment, we all know that it is there. But it's been proven that prevention works. So opening up those conversations and really talking about that stuff is important. And we see that that is one of the things that will help prevent that from happening.
Right. Well, and you touched on something very important in our community, I know throughout the state, I'm sure. Prevention is very, very difficult to measure. What can you tell us about how we are identifying results, how we can identify, how can we tell if it,
Right.
How can we tell if it's effective?
Well, and it is hard. Prevention is very difficult to measure because it's hard to say this person went through this program and therefore they didn't start drinking. That you can't measure that. It is encouraging, I think, when we look at the Missouri Student Survey data and seeing the numbers going down. So less kids are drinking earlier, less kids are drinking often, like binge drinking. So those numbers are going down in Missouri, and so that's encouraging. I think it's showing that, yes, we are making a difference. Right. But it is very hard to measure that, and see who have we helped, who have we stopped from doing that. Right. But the data, especially in 2014, the data from 2012 to 2014 showed significant decreases. So that was encouraging to us when those numbers came out.
Very encouraging, yeah. I know that when we got our local data specific, it was reassuring that at least we're moving the needle in a positive direction. Right. And now it's like, oh, are we going to be able to continue this success?
Well, and I think people get afraid too whenever we say, oh, the numbers are going down, especially so many of us are nonprofits, that we're going to lose funding for that kind of stuff. So I think it's important that we all get that message out, that prevention's working. It's not that it's stopping and therefore we don't need to fund that anymore. So I think that people get nervous about saying, oh, look, the percentage of kids that have drank in the last 30 days is going down. But that's because our programming is working.
Right, and because we are implementing programming and we are communicating this to the students at that level and the parents at a different level and trying to reach out in various different aspects. Now with your training, most of it is done, the training that ACT Missouri does is mostly done directly to the coalitions for them to do in their local communities. Is this correct?
Yes, most of our trainings, we either train regional support centers or coalition members or a combination of both. Okay. And the plan is then that those coalitions can then go out in the community and implement the strategies that we've talked about. Okay, so so the strategies that you're identifying, that you've communicated to the various coalitions, including Council for Drug Free Youth, are effective, are based on evidence and results, and so that it's not like we're just throwing darts up at the wall. Right. Yeah, we only use evidence-based trainings and things that have been researched and proven to work, and so they're proven effective. And that's, I think, important that people see that, one of the things that we pride ourselves on when we put a fact sheet out or when we put information out, we always have the source at the bottom. So people know we're not just pulling those numbers out, we're not just making things up, and they can go look at those studies that we show. And it's the same way with our trainings. We want people to know where that training came from and where we got that information. We try to be very transparent in that kind of stuff.
And it's interesting that you point out that you show where the data is obtained, because a lot of times the pro-substance use or the people in the community that are like, oh, well, that's what we did, when back in the day when I was a kid, that's how my parents handled this situation, or that's how I handle it with my kids, and I don't know why, we're having these problems. They can just say whatever they want without any data or anything to substantiate it, whereas the information that you provide, you feel compelled to provide substantial data to prove the results.
Right.
And you mentioned evidence-based. What about, now, what's the difference between evidence-based and best practices?
You know, best practices means someone has taken something that's evidence-based and it shows you how to implement it in your community. You know, evidence-based sometimes I think can be a little bit more research-driven, not necessarily practice-driven.
Right.
So they're both important, and I think they both have really good places in what we're doing, but there's a little bit of a difference between the two.
Right, and both of them show outcomes.
Right.
And results that are positive.
Right.
But sometimes they're just the terminology
Yes.
is different.
Right.
Based on research, how much research goes into the background, backstory. Yeah, I didn't mean to throw you with that question.
You're good.
Sorry about that, Natalie. Since we're having all these challenges with our word, maybe we'll take a little quick break, and then we can discuss some more of the effective solutions and how ACT Missouri is training the trainers, so to speak, and training the resource centers so that they can train the community coalitions to be effective and really implement strategies and practices in their own communities that affect change on an environmental level rather than just on an individual level. And that's something that I've learned recently that I really want to touch on here, because that's so important.
Very important.
If you're really going to change it, the situation over a long term. And so we're going to be right back with Natalie Newville of ACT Missouri, the Public Information Officer for ACT Missouri, and she's got a wealth of information to share with us. Thank you so much.
Over 1,000 Central Missouri kids are in foster care. Nearly 400 will age out of foster care without a forever family. You could be the one to make a difference. I'm Deanna Alonzo, former foster youth and executive director of the Central Missouri Foster Care and Adoption Association. Our organization supports foster and adoptive children and families. We are working to change the statistics for these kids. Be the one who makes a difference. Find out more at ccfosteradopt.com.
Hi, I'm Jessica Ash Schulte with Dreams to Reality. Dreams to Reality is a not-for-profit agency in Jefferson City serving women across mid-Missouri. Our mission is to help low-income women meet their employment goals and build self-confidence by providing appropriate interview and business apparel, motivation, and follow-up support. We serve clients referred to us by many local agencies, and all services are free of charge. Not only do we provide appropriate interview and work attire for women seeking and retaining employment, but we also provide a more comprehensive personal image consultation to ensure clients are ready and confident as they strive to meet their employment goals. Dreams to Reality helps women enhance their potential to be gainfully employed and achieve self-sufficiency to support themselves and their families. For more information about our services or to see how you can support our mission, visit our website or like us on Facebook. Dreams to Reality is proud to be a United Way partner agency.
Hi, and welcome back. We're here with Natalie Newville of ACT Missouri, and we were just chatting about the prevention in the state of Missouri and their training efforts to train local area coalitions to help environmental strategies. And I wanted to touch on that a little bit with you, Natalie, because environmental strategies is kind of a new, relatively new concept in prevention, where we aren't just treating an individual. And it was explained to me in the fact that if you've got a pond that's polluted, instead of just taking one fish or one frog out of that pond and healing that one fish or that one frog, you remove all the frogs or all the fish, heal the pond, and then you can put them all back in, and they're all healthy. And so I was like, okay, that makes sense. Now how do we do this?
Right. And I think there are lots of ways that you can do that, both on the statewide level and the community level. I think a great example on the statewide level is when they started the KEG registrations, you know, pertaining to underage drinking. You know, that's changed a lot of habits in a lot of communities but that was a statewide change. Community levels are another great way to do it. Something as simple as parks where, there's no drinking allowed in parks. Or where, your police officers or whatever are driving around checking the parks to make sure there aren't kids out there doing things they're not supposed to. School policies, so not having tailgating before football games, that kind of stuff. Or even something as simple, I've heard of schools where they still allow like the styrofoam cups. And we've heard directly from the students that kids are putting alcohol in those cups and going into their school. So, something where it requires clear containers. So there's lots of different ways where you can make a lot of positive changes with small steps. Training your bartenders or your convenience store, grocery store workers so that they're checking ID every time. Things like that are great ways to impact your environment that way.
Responsible beverage server training. I think we've got that going on in our community right now, as a matter of fact. And,
Good.
and yes, I mean, and the 7 strategies that I was, made aware of were the information, the skills, support, the consequences and incentives, and then the reduce and increase barriers, and then changing the policy, and then you mentioned changing the physical design or certain things that are allowed in various places. Sometimes it's just a matter of, there's bushes where the kids can hide behind, and you move the bushes or do something as simple as that,
Right.
Or add lighting to a certain area and stuff like that. Council for Drug-Free Youth is very concerned with recreational marijuana use. That's another one of our targets for this year. What can you tell us about marijuana in Missouri and specifically in Jefferson City, if you know anything about it specifically here, or just what can you tell us about it in Missouri?
And we focus mostly statewide, so I don't have the number specifically for Cole County or Jefferson City. Statewide, there is legislation that's been going through to legalize it both medicinally and recreationally. There was some legislation that was passed last year, so the 2014 session, that allowed medical CBD oil for, CBD oil for epileptic patients. So that is legal now in Missouri. There are a lot of stipulations for that, and they're still working through that process on how you're going to grow it, who's going to grow it, that kind of stuff.
So that's not all been worked out in the legislation yet?
No, last I heard they've awarded the 2 nonprofits that will be growing and dispensing of the CBD oil, but that's as far as we've gotten, as far as I know.
And they're both nonprofit organizations?
Yeah, and that was the requirement that the legislator put on it because they didn't want someone coming in here trying to make a ton of money off of selling it. So the stipulation was it had to be nonprofits. So there are 2 now in Missouri that have those licenses from the Department of Department of Health and Senior Services and the Department of Agriculture.
Okay.
And so that was in 2014. In 2015, there were several bills going through. One was to expand the CBD oil bill to other diseases and ailments, which is interesting because it's not implemented yet. So then we were expanding it, or trying to. It did not pass.
Okay.
And then some medicinal bills as well. So at this point in time, as far as the Capitol goes, mostly what they're working on is medicinal. There are some petitions out there for the 2016 election that would make a constitutional amendment where they would change the Constitution for recreational marijuana. So that's something that they will be collecting signatures on soon out in different communities across Missouri. So they're working on it. The people that are pro-marijuana are trying to get that stuff passed, both medicinally and recreationally in Missouri. So it's coming, it's happening.
It's presenting all kinds of challenges for us, for me specifically right here in our community. But one of the great things that we have going on here in Jefferson City, which I probably should share, is that our mayor is going to be signing a proclamation at our June 1st City Council meeting, basically stating that marijuana is harmful to youth. Right. Recreational marijuana is harmful to youth. And then we are also going to be having a town hall meeting on June 11th at 6 p.m. to kind of share some of this information, and I believe that there's going to be representation from ACT Missouri as to how marijuana is harmful to youth.
Right.
Can you touch tangentially on what's going to be discussed at the town hall meeting?
Well, we're still working on all of those plans. One of the things that it's important to note, alcohol is one of the most abused substances amongst teens. I believe it is #1. And part of that is because it's legal. So kids look at it as not being harmful because it's legal. And so, when the perception of harm goes down, then use goes up. So, we anticipate the same thing happening as marijuana is legalized more and more, that perception of harm is going to go down, and so use will go up. And that's, that is our focus, is on youth. And we don't want to see kids being hurt by it. And so at the town hall, we'll be talking about just different statistics, science-based, evidence-based, things that, how it affects kids. So.
Right, how youth marijuana use impacts them adversely.
Right.
And there is evidence to the fact that even though it's not necessarily chemically addictive, it is behaviorally addictive.
Right.
And do you have information that you're going to be sharing regarding that?
We will have all kinds of good stuff there, that handouts, and we'll have experts come in and talk about that kind of stuff. So I always refer to the experts when it comes to that stuff, because I feel like they know it really well. So.
You're like, okay, this person would like to share this information. You just bring them to the table.
That's right. That's what I was telling. I don't vet the information. I just disseminate it. So they vet it and tell me it's good.
Okay. And here's the source from which it came.
Most definitely.
Well, and with ACT Missouri being part of the statewide and this initiative taking place on a statewide level, what impact does that have on you and the training that it requires from ACT Missouri?
Well, and I think that if it becomes legalized, if that happens, then we will have to focus with our coalitions. You don't think about workplaces, what kind of HR policies are going to have to be put in place, what kind of policies at schools are going to be put in place. So I think our training will change in that, on how to really look at that and protect the kids. We know alcohol is 21 and up, but the average age of first use is 13. So how do we address that subject and really make sure that these kids are staying safe? Because that is our #1 priority.
Well, and you brought back alcohol, and so, yes, it's illegal for 13-year-olds to drink, yet it's still happening.
Right.
And so do you think addressing some of these environmental strategies that we discussed are important, and really how will they effectively change the dynamic of the way communities are handling underage drinking?
I think they're definitely important. One of our programs is the Missouri Youth Adult Alliance, and its focus is on preventing underage drinking. So they do all kinds of different programming with that. We have youth ambassadors, which are youth from all over Missouri, who come in and they're trained on advocacy and they're trained on preventing underage drinking, and they go back to their schools and their communities and do those trainings. So that's, I think, a great program. And that's really impacting our local communities on, that level. We also are the SAD state coordinator, so Students Against Destructive Decisions. So we coordinate all the SAD chapters across Missouri. And then our Maya program does all kinds of other, we have Speak Hard, which is our youth conference. So youth from all over Missouri come in and they're trained on advocacy, and then they get to go talk to their legislator and really put that training in action. So there's a lot of environmental things that we're trying to do where we're training them on how to go back and do it in their own community. Because me coming in from Jefferson City and going, to Springfield or to Cape Girardeau and trying to implement it, I don't know their communities. But when you're on that coalition, you know that community.
Right, and you know what issues that community specifically faces.
Right.
And having you as a resource right here certainly does help Council for Drug-Free Youth, but it also, having the youth as a resource for any community to say, look, this is really happening. Yes, I see my peers doing this, and yes, we need to address it, and here's some of the things that we as youth would like to look at or would like to explore. I definitely feel that it has so much more power when they go and advocate and,
Right.
and talk to the representatives or legislators.
Right. Well, and I think it, you know, those representatives are more likely to listen to them too. Kind of as an anecdotal story, I lived in Sedalia before I came here to Jefferson City, and we had members of one of the coalitions, the youth members, go and speak to the mayor and to the community about enacting a smoke-free ordinance. And at that time, our mayor was not in favor of a smoke-free ordinance, but after listening to those kids, she changed her mind, and she was the deciding vote that got the smoke-free ordinance passed. So I feel like you don't really realize how powerful that youth voice is. But it is, you know, it's hard to look at a kid and be like, well, I'm going to decide your future, you know, when they're asking for something.
When they're asking for the support and the help. Right.
Definitely.
It's very, very impactful and very powerful to have empowered youth coming forward and speaking. And so I really appreciate all the work that you do as well. And thank you so much. I appreciate your time here today.
Thank you.
And hopefully we'll have you come back at a different time.
Yes.
And thanks for sharing everything that ACT Missouri is doing for our whole state and especially in our community.
Yes.
Thank you again, Natalie, for
Thank
being
you.
here. And thank you so much for joining us today with Natalie Newville from ACT Missouri. Next week, our guest will be Heather Geek from the Healing House. Hopefully you can join us again. Have a wonderful day.